my name is Santi. Welcome to my presentation. Today I will be talking about Tirzepatide and Trulicity. Some learning objectives. I will be explaining the pharmacological similarities and differences between Trulicity and Tirzepatide. This includes their mechanisms of action, indications, and clinical outcomes. I'm also going to be explaining why Trulicity and Tirzepatide are considered drugs of concern in society, which includes issues related to safety, misuse, and accessibility, and in public health. Some concerns of the drugs have been an increasing amount throughout the world due to weight loss medications like Tirzepatide and Trulicity. Many people turn to them for health reasons. Social media has also taken pressure for younger generations to look a certain way and avoid judgment. This can also be a reflection to the deeper issues about societal expectations and body image issues. Injectable weight loss medications, GLP-1RAs stand for glucagon like peptide 1 receptor agonists. They act like a natural hormone in the body and work by making your food leave much slower in the stomach. This can also increase insulin release, sending signals to the brain saying that I am full, so there is less hunger and less food has been eaten. These drugs have been approved by FDA, or known as Food and Drug Administration, to manage type 2 diabetes. But these medications are also known to be approved for weight loss drugs. Background of Tirzepatide. It was created in early 2016 by Eli Lilly and Company in Indianapolis, Indiana. It has a GLP benefit, but it also mimics it as another hormone. The other hormone is GIP, which means glucose-dependent insulin-trophic polypeptide, which can help enforce all signals to eat less in the brain. The weight loss shot has been approved by USF Food and Drug Administration, like I mentioned, by May 2022. The popular grew as it was demonstrated in significance in being more effective in supporting patients' weight loss journeys. Social media also had an impact of creating an awareness of Tirzepatide. How many individuals did not know of the potential side effects. For Trulicity, it was also created in the same company by Eli Lilly and Company. However, it was made in September 18, 2014. It was also approved by US FDA in September 2020. Popularity of growing had an unexpected increase in June 2022, with patients wanting to improve their blood sugar control. It was also regarding a social media influence. Trulicity also promoted communication for better treatment. Many individuals still were unaware of potential side effects like Tirzepatide. Cost of the drugs, Trulicity was listed about roughly $900 depending on the insurance, and Tirzepatide was listed roughly about $1,079 per fill. This was just dependent only on insurance. Some benefits of the drugs. Trulicity, people can lose up to 10 pounds. It can help lower hemoglobin A1C, with majority reaching under 7%. This means hemoglobin A1C is a blood test where doctors look to see how well controlled your sugars are. In the past 3 months, if you are 6.5% or more, then you are considered having diabetes, and most patients are needing to make aggressive changes in their lifestyles, and if they can't bring it down, they have to take medications, because poorly controlled diabetes can cause issues like nerves, tingling sensations, eye changes, kidney problems, and other issues like increasing of heart attacks. It can also treat 2 diabetes, improves your metabolic health. And for Tirzepatide, people lose up to 1 to 3 pounds per week. Max weight people lost was about 20 pounds. Can also help you lower your A1C about 1.9% if you're using the baby dose, which is 5 mg. And if you're on the 15 mg, you lose about 2.1%. It can also, again, treat type 2 diabetes, improve your metabolic health, and by you controlling your weight and lowering cardiovascular diseases like strokes, heart attacks, and deaths. Some side effects of these drugs. For Trulicity, we can see it's nausea, diarrhea, vomiting, decrease in appetite, fatigue, indigestion, Tirzepatide has stomach pains, diarrhea, vomiting, constipation, fatigue, and abdominal pain. But as I was researching it, I was looking through the deeper side effects of these drugs. Trulicity was reducing risk of thyroid cancer, acute kidney injury, acute interstitial nephritis. Tirzepatide was a risk in the thyroid C cell tumors. Colitis, which means it was affecting the gallstones. Dyspepsia. Some lawsuits of the drug. According to the United States State District Court for Eastern District of Pennsylvania, Trulicity was a part of a federal lawsuit claiming that the manufacturers downplayed for a serious gastrointestinal risk like gastroparesis and bulk obstruction. Tirzepatide aren't really a part of the target in multi-district litigation, but Eli Lilly and Company were suing many pharmacies and telehealth, where they were selling unapproved or compounded versions of Tirzepatide. After you described how reports were related to many patients mistakenly drawing up in those vial. Some patients were also being influenced by advertisements that do not offer balanced communication of risk, or more frequently, obtaining GLP-1 RAs from online delivery companies, medical spas, or other groups with adequate patient education. Then some potential errors that can overuse and misuse these drugs or products. Counterfeit products. Counterfeit products are now entering into the U.S. supplies. According to Brown Health Mountain 2025, Poison Control Centers saw nearly 1,500% increased calls in 2013 on accidentally overdosing on compound GLP-1 weight loss. Compounded versions may come in multiple dose and vial pre-filled syringes with various strengths. There is no standardization. Thus, there is an increase of miscalculating or unintentional drawing inappropriate dosage. Per Journal of American Medical Association, we recommend requiring advertisements for compounded products to meet the same fair balance standards expected direct consumer advertisements of prescription drugs, the aggressive prosecution of bad actors who are illegally trafficking counterfeit or adulterated GLP-1 RAs products, and also an independent task force outside of the FDA to be charged with the final determination for adding or removing a drug from the drug shortages list with a clear framework for decision making. Which means, for instance, if we see patients are unfamiliar with using syringes, they can have accidentally administered 5 to 20 times than the intended dose, and providers have been miscalculating conversions from milligrams to units, leading to severe side effects, like I mentioned before, and some instances, even hospitalizations. For the future, according to the American Society of Plastic Surgeons, similar weight losses injection drugs like Ozempic, Mounjaro, Victoza, Wegovy, and a new medication called Triple G. This means we had to ensure patient safety. We must establish future healthcare regulations by addressing injections practices to minimize the risk of misdosing. Public health impact. For obesity, worldwide over 1 billion people were classified as obese in 2022, which represents about 13% of the global population. Obesity can cause liver disease, high blood pressure, diabetes, potential risk during pregnancies or strokes. Some management skills we need to do are having a lifestyle change, weight loss, reducing the risk of cardiovascular disease, reduce our A1C. Trulicity and Tirzepatide can only prevent diabetes and fatty livers. In the public health perspective, we can see Tirzepatide can help in cost saving and improve efficiency with healthcare systems that can help decrease in obesity related situation. Tirzepatide can also help in demand and access and affordability issues. However, in 2020, about 16.8 million emergency department visits for Trulicity, and on the contrast, Tirzepatide was at least one emergency visit and hospitalizations related to the medication, which was about 13.16%. And Trulicity has been used widely over the years and has been increasing access to injectable diabetes therapy. Some real life celebrities we might know are like Whoopi Goldberg, Serena Williams, Elon Musk, Lizzo. Some conclusions I've made while researching were Trulicity and Tirzepatide are not just a joke. Their side effects can have led to many lawsuits and have increased emergency department visits. Both drugs can help in reduce weight and also have similar side effects, but there are some differences. Some things to think about and some questions that I want to ask you. Are there any needs for tighter regulations with these drugs? How can we prevent people from overdosing these drugs? These are my references.